Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Not all heart disease is obvious. We hear about athletes who otherwise appear healthy collapsing mid-court because of an undiscovered heart defect, or the young mother who dies suddenly due to an unknown genetic disorder that causes the electrical system of her heart to malfunction. Today we'll be talking about hidden heart disease and the hints you may be ignoring but shouldn't. Welcome to Healthy Living for Life, a show designed to help you do just that. I'm Lisa Sattler, your host. Stay tuned. Welcome back. My first guest today is Dr. Sharon Hecker with Rocky Mountain Heart and Lung in Kalispell. Welcome, Doctor.
Oh, thank you. It's a pleasure to be here.
Thank you. So let's start a little bit about talking about young, fit teens and adults. We sometimes hear about athletes suddenly dying from a heart abnormality. Can you talk a little bit about what might cause this?
Yeah, that's a very tragic problem. Whenever we hear about it, it shocks everyone. But fortunately, it's very rare. There are a few common causes. Half of it is due to a disease called hypertrophic cardiomyopathy. That's an abnormal thickness in the heart muscle, and it can lead to problems with the heart pumping blood out to the body when you're during exercise. And it can also lead to arrhythmias, where the heart starts to fibrillate and stop during exercise. Other conditions that can cause this are congenital abnormality of the electrical system. We call that long QT syndrome, or Brugada syndrome is another example of it. That can be picked up on an EKG, but it might manifest itself by a person suddenly passing out without any provocation, maybe even during exertion. And then lastly, another cause is coronary or cardiac anomalies that a person may have been born with, but that don't really show up until their teen or young adult years.
So I've heard stories of athletes who've potentially received a blow in the chest and had something happen with their heart. Can you explain a little bit about that?
Yeah, that's actually very interesting and very survivable if it's treated properly. So I really want to get that out to people, that you can do something about it. Most commonly, we've heard about like the line drive that gets the pitcher right in the chest. The ball hits the heart at a time in the electrical cycle where the heart is vulnerable, and it will just immediately start to fibrillate or stop pumping blood. So the heart stops and the young athlete will collapse. The good news is that if you can start CPR right away, or get one of the automatic external defibrillators to defibrillate the heart, the person can recover completely. And we have many examples of that. So if you happen to be at a game and see an athlete get hit in the chest and fall down, it's very important that you act quickly.
Thank you. That's very good information. So can you tell us a little bit about the difference between a heart attack and cardiac arrest for our viewers, please?
Yeah, that's very confusing to people, and understandably, right? You know, they sound like the same thing. So a heart attack is when there's an interruption of the blood supply to the heart muscle. The heart muscle at that point will start to die. People can have heart attacks and not even know it. So they will lose a small portion of their heart muscle and actually survive and go on to do other things. Sometimes, however, when a portion of the heart muscle dies, it again causes the electrical instability, which causes the heart to fibrillate and stop, which is called a cardiac arrest. So the heart can fibrillate and stop due to electrical problems and not due to a loss of blood supply, a heart attack. So you can have a cardiac arrest without a heart attack, and you can have a heart attack without a cardiac arrest, but sometimes the two go together. One is electrical, the cardiac arrest, and one is more of a plumbing issue, the heart attack.
Are there symptoms with cardiac arrest?
Usually not. That's kind of when you hear of people who just keel over and die suddenly. However, if you have episodes of lightheadedness, or sometimes palpitations, or if you've actually had a previous cardiac arrest, you'll be at higher risk to develop a cardiac arrest.
And anything else that might put somebody at risk for cardiac arrest, certain lifestyles or things like that. Could you maybe talk a little bit about that?
I love to talk about lifestyle.
Okay.
And the reason I love to talk about lifestyle is that even in the highest risk patients who have the genes, the cholesterol, the cigarette smoking to lead to a heart attack, everyone can cut their heart attack risk by more than half by lifestyle interventions. And when I say lifestyle interventions, I mean regular exercise, eating a diet that is rich in fruits and vegetables, and maintaining your ideal body weight. Smoking cessation is also really important.
That's great. So we just maybe have a couple of minutes left right now. Can you maybe let us know some of the hints that your body might be giving you that something is indicating a problem with your heart?
Yeah, I think the biggest thing to look for is an abrupt change in the way that you feel. So for example, if every day you go out to get the mail at the mailbox and you feel fine, and then one day you start developing shortness of breath long before you ordinarily would, or some chest discomfort, or a tight or heavy sensation in your chest, any type of change I think is really important to pay attention to. If suddenly you start developing palpitations or feeling a fluttering in your chest, an irregular heartbeat, or new lightheadedness or fatigue that you hadn't perceived before, it's very important to discuss that with your doctor or your healthcare provider.
Swelling in your limbs, is that a sign or symptom sometimes as well in your feet?
Swelling in your limbs definitely goes along with heart failure. However, lots of people will get swelling, the imprint of your sock, for example, left on your shin after a car trip, which ordinarily isn't a big problem. However, if you start getting increasing swelling that you've never had before, or it's really starting to trouble you, you need to discuss it with your physician.
Great, thank you. We're going to talk with Dr. Hecker a little bit more after the break. Please stay with us.